Assalamualaikum and very good day to everyone. My name is Mazriyana binti Kasim. Today I would like to present my research with the title Organ Donation and Transplantation, the Knowledge and Attitude of Nurses. Before we begin, let's see my content outline. I will begin with the introduction, literature review, methodology, finding, and lastly is about conclusions. As introduction, organ donation refers to the healthy organs and the tissue taken from the donor and transplanted into the recipients. Every day, the need for organ donation increases worldwide due to the organ insufficiencies caused by chronic diseases. A persistent shortage of organs and inexhaustible waiting lists continue to result in many people dying awaiting transplantation. In successfully promoting organ donation, it is important that nurses have a higher level of knowledge and a positive attitude towards organ donations. Organ failure is a serious issue globally. There is a long waiting list of patients, but there is only a short donor list. In Malaysia, the number of organ donors remains low to provide sustenance and improve living qualities in the patient requiring transplantation. Based on the International Registry on Organ Donation and Transplantation 2021, Malaysia reported a shallow disease decrease in the donation rate of 0.2 per million population. Participation in the organ donation procedure is one of the required tasks in the nursing professions, and nurses play an important role in this regard. Knowledge, attitude, everyday practice, and confidence in organ donation have been found to be major factors, with most studies concluding this to be significantly influencing nurses' participation in organ donation. To enable organ donation, it is essential to identify the knowledge and attitude of nurses on organ donation, since they are in close and direct contact with organ donors, and they can influence patient families in the judgment call process. So, my research objective is to assess the level of knowledge and attitude towards organ donation among registered nurses in one of the tertiary university hospital in Penang, Malaysia. Before we go further, according to World Health Organization 2013, organ donation refers to the healthy organs and tissue taken from a donors and transplanted into the recipients. Many studies has been done regarding knowledge and attitude on organ donations among the nurses. Majid 2016 mentioned that nurses' knowledge and attitude are essential to improve organ donation in the future, and they play a key role in identifying potential donors. Their personal experiences and action can play an important role in the decision making of the prospective patient or intenders about organ donation. According to Z et al. 2017, a low level of knowledge and lack of personal attitude make the nurses less confident to carry responsibility in communicating, teaching, advocating, and comforting the family for the organ donation. Study in the Serbia by Vlaseljevic and Zinanovic 2018, knowledge, attitude, everyday practice, and confidence in the law have been found to be a major factor, with most of study concluded this to be significant in the influencing nurses' participation in organ donation. Osdak 2019 mentioned that adequate knowledge and level of education increases nurses' self-confidence and were the factor affecting acceptance and willingness to be involved in organ harvesting efforts. According to Hosseini et al. 2021, in Western countries, majority of nurses and health professionals have a positive opinion about organ donation. However, a negative finding is very small percentage are practiced in promoting organ donation and transplantation. Study in Korea by Join and Kim et al. 2022 state that majority of the nurses was agreed organ donation is important in saving a life, but they did not practice and never discuss with the family of potential donor regarding the issue of organ donations. This study was conducted to registered nurses at one of the tertiary hospital, University Hospital in Penang, Malaysia. A total population of 137 nurses was selected in this study. However, only 102 nurses participated in this study. Multiple choice questions are selected to assess the knowledge regarding organ donation. The knowledge score was classified into 3 categories, with the highest score considered as having good knowledge. Attitude of respondent regarding organ donation was measured using 5-point Likert scale. The highest score showed a more favorable attitude towards organ donation, and the lowest score is otherwise. To establish the validity of the questionnaire, the prepared instrument along with the scoring key and attitude scale was validated by 3 experts who is director of the National Transplant Resource Center, 1 senior supervisor in National Transplant Resource Center, and one organ transplant coordinator. So the finding of this study shows that majority of the respondent aged between 31 to 35 years old, and 85.3% is a female, and mostly respondent working experience about 11 to 15 years, and majority of the respondent working in the inpatient care in that hospital. For objective number 1, the majority of respondents have good level of knowledge about organ donations. For the objective number 2, the majority of respondents have a good attitude about organ donations. And for the objective number 3, there is a significant cessation between age, working experience, and working area of the respondent with the knowledge regarding organ donations. And lastly, there is a significant association between age, working experience, and working area of the respondent with attitude regarding organ donations. Regarding knowledge on organ donation, this result of this study revealed respondent knowledge of organ donation is good, as 78.4% of respondents get marked between 7 to 9. The highest knowledge towards organ donation among registered nurses is correlated with the updated knowledge during continuous nursing education program among the nurses. A campaign to be a donor from the company, and this hospital also has recorded the history when the primary immunodeficiency team successfully collaboration with the transplant unit in Kuala Lumpur Hospital. This exposure may also affect nurses' knowledge regarding organ donation. Despite having a good knowledge of organ donation, some of the nurses are still unable to recognize the meaning of brain death, and this situation is considerably worrying. McGlade et al. 2018 also discovered the same finding on the concept of brain death, where the legal definition has been frequently misunderstood by healthcare professionals. This finding was supported by the study of Kasim and Shohor 2021, which stated most nurses have expressed their fear towards acceptance of brain death, which can compromise the patient's life. A lack of knowledge on brain death could cause nurses unwilling to identify the potential donor, leading to the missing the opportunity to get viable organ for transplantation. For the attitude on organ donation, based on the finding of this study, 79.4% of nurses show a good attitude towards organ donation, especially on organ donation is a merciful act, and donating an organ to another person improves the sense of humanity. However, the negative finding has shown 34.5% of nurses are still undecided about not including organ donation requests as part of their job. This finding was similar to the Kim et al. 2019 in Korea. most of the nurses agreed organ donation is an important way to save life and provide the opportunity to improve the quality of life. However, some of the nurses had never discussed with the family or potential donor regarding the issue of organ donation. This indicates most of the nurses understood the importance and positive impact of organ donation, but they are not accepting or considering organ donation in the practice. In this study, age, working experience, and working area play the main role in influencing good knowledge and positive attitude of nurses toward organ donation. There is a significant correlation between nurses' age, working experience, and the current working area with the knowledge and attitude towards organ donation. Similar finding discovered by the Elding and Scholes 2017 and Kim et al. 2021 stated some of the nurses feel not confident to approach and initiate the discussion in the donation process due to a lack of experience. Floden and Fosberg 2019 stated nurses' experience, knowledge, and attitude may significantly influence the identification of potential donors and plan the best way to support the family. Mayers and Bijok 2017 found out a few of the nurses who have extensive experience in actual donor acquisition have heightened the perception of professional competence in donation. This study also indicates that nurses with the previous donor experience have a good knowledge and more positive attitude towards organ donation compared to those who do not. As conclusion, even though nationwide public campaign has been done, the number of organ donors in Malaysia is still below satisfaction and unable to meet the demand. Nurses play a significant role in increasing the donation rate and educating the public about organ donation, but only if they are knowledgeable and having positive attitude on the topics. To successfully promote organ donation and transplantation, it is important that nurses have high knowledge and positive attitude towards organ donation. Thank you, and that's all.